Welcome everyone to Valerie Lamb Bentley's Capstone Defense. Very excited to see this. Just want to kind of run through how it's going to go today. Valerie, you will present for up to 25 minutes. Then we're going to have a round of questions, starting with her supervisor, Mark John Stewart, and then her second reader, Alex Sévigny. And then we'll go through a potential second round, and then we'll open it up to everyone who's watching if you have questions as well. But please hold those to that time so we can get through the rest of the process. Valerie, I will hand it over to you.
Thank you, everybody. So my capstone today is on the subject of AI adoption, and it's tailored for Canadian healthcare leaders, presenting a strategic AI roadmap. So what I'd like to go through today is to acknowledge the fact that many healthcare leaders are in a state of experimentation with their AI adoption, but they desire to move towards a state of sustainable impact and a way that drives business value. So I'll be referring to the term business value, and what that refers to is the health system and organizational value. So this might include patient outcomes, safety, access, operational efficiency. And we'll look at a number of success factors that the participants named, as well as the key barriers to adoption and optimization, as well as some recommendations. The research problem I sought out to solve is the fact that Canadian healthcare leaders are facing rapid AI change, as well as the pressure to improve outcomes with AI, but they lack clear guidance on what AI optimization actually entails. These gaps do not reflect a lack of purpose, but rather an absence of clear integrated pathways to translate those priorities into action. So this study fills that gap and helping to with an understanding of what responsible AI means in healthcare settings, as well as what healthcare organizational leaders can do at the enterprise level to seize these AI outcomes. I used a triangulated research method, including a literature review, survey, interviews, and focus groups. And this method strengthens my findings because I'm cross-referencing the main themes and findings. The study is also inductive in the sense that I sought to understand the situation based upon trends that emerge from the data itself, rather than having a hypothesis I wanted to solve or a theory to prove. And this inductive method was on purpose because AI is such a novel and emerging theme and sort of challenge and opportunity that leaders are grappling with. So I wanted to understand what's happening on the ground given the novel situation. Within the literature review, I wanted to highlight a few key themes that emerged. One is that organizational AI adoption is a high-risk transformation. And this is because healthcare as a sector carries many inherent standards and robust risk mitigation strategies and standards as well that protects patients from harm. So AI adoption in this setting means that you have to also satisfy many high-risk standards and regulation, and think about AI adoption in the whole realm of healthcare system transformation rather. So it's not a simple technological implementation. And these risks are felt at the clinical level, operational level, and reputational level. And we know that the decisions made as a result of AI recommendations have clinical real-life impacts to people's health. Responsible AI is another main theme that emerged, and really to understand it as a multifaceted concept, you're looking at driving data stewardship as well as mitigating bias, providing a clear communication and transparency between end users and providers of AI and health itself. But however, most organizations will only operate on principle when they're looking at responsible AI and not in terms of practice itself. So this gap shows a need to translate ethical intent into governance and execution. The other theme is leadership capability. And what I mean by this is that AI and leadership capability is not just about IT leadership, but the ability for leaders to have literacy and therefore drive impact for the organization. So AI literacy, which is something I'll get into in the study, is really critical. It allows leaders to define value, assess the risk, and also guide AI adoption. Communications and change management is another key theme that emerged, and the research rather shows that AI adoption requires active communication and trust building. So stakeholders need to understand how their data is being used, and also that they're being engaged through consent with how their information is being mobilized through the different technologies and even brought from provider to different system partners. So we're seeing as well that traditional change models in the literature are not sufficient, but effective adoption is an iterative process and needs to be people-centered and leadership-driven. So one key takeaway from the literature review is that AI adoption succeeds when organizations prioritize leadership, trust, and governance, rather than just treating AI as a technological tool. I just wanted to raise a quick slide here about some key concepts that emerged from the literature review and informed my analyses as well. The technology organization environment is a framework to help leaders guide the decision making through technological change in particular. And the strategic flexibility concept, sorry, my mouse is doing funny things. The strategic flexibility concept is a way of looking at change as a mindset. And what this enables organizations to do is to be nimble with how they understand and coordinate change based upon the available to them, notably big data available to them. In terms of dynamic capabilities and resource-based theory, this is a look at how organizations can actually leverage their existing and internal resources to gain a business advantage. So this is, understanding how your resources can be reconfigured in a way to sense and seize the innovation opportunity in front of you. It's really looking at your resources as opposed to looking outside. And finally, change management as a key concept and dynamics through AI adoption. We're seeing that navigating change management with AI requires a type of ambidexterity where AI is both novel as well as routine in its use. So this sort of dual dynamic is important when we're thinking about how leaders can conceptualize change in AI adoption. And also just to touch on the scope of my research, here we go, change this slide. Most of my studies came from a sample of participants based in Ontario and publicly funded primarily. And also the leaders are representative management roles, specifically with some representation at the executive level. I also conducted a survey, and notably, there were 20 full responses with 44 partial completions, which I'll get into in the findings, but that becomes a very interesting sort of area of discussion, as well as the interviews and focus groups, and I applied thematic analyses to this qualitative data and also used inductive coding. Just to highlight almost like a light table of contents here from the main themes that emerge from the primary research. AI literacy is a really key factor, and if it's a low literacy, then it becomes a constraint, and it's really AI risk instead of fear that is shaping adoption. Training, trust, and explainability are key facets of leadership with AI adoption, and AI business value can be assumed, but not very well defined. And also AI resource orchestration becomes more important than the actual volume of AI resources that one may amass. So to dive into the first finding, low AI literacy is a foundational constraint. And what this means here is that most leaders in the study actually have a very low maturity when it comes to AI literacy. Many are early adopters and sort of figuring it out as they would describe it themselves. They're using AI for operational and clinical enhancement through sanctioned tools that the organization approves, like Microsoft Copilot. But the adoption pause is because they're worried about what happens to personal health information when it's entered through AI. So this has to do with the risk and data as well. And this is because, like I mentioned, when the sector is highly regulated, and so there are standards at the provincial and federal level about how health data should be stewarded. And many healthcare organizations are familiar, unfortunately, with cybersecurity risks, so they're sort of hyper vigilant about that. So in light of the low AI literacy, there are three key risks that emerged from the study. One is that sort of this unknown unknown. So if you don't understand what something is, you just can't use it. So this limited participation can really hinder an organization to drive outcomes with AI. Secondly, low AI literacy exposes the organization to significant safety risks through unintended use. And also, thirdly, at scale, limited participation due to low literacy creates limited ability to even leverage AI at a national level. If we don't have organizations leading domestically, then we start to rely on foreign firms. So we see that AI literacy is foundational, but also for patients and end users, they need to also have a degree of AI literacy so that they can understand how AI is being sort of offered in front of them and how it's interacting with their treatment plan and their diagnoses, and be able to give informed consent. So to mitigate these risks, many leaders are using a very cautious approach to consent as well. And we're seeing that AI literacy can become both a risk factor and an enabler for innovation. I wanted to touch on an interesting case study that is a good example of AI literacy. So you may be aware of AI scribes. This is a technology where doctors would turn on their scribe and help automate the documentation of that consultation. And this is a good example of AI adoption, not literacy. AI scribes are a good example of AI adoption because physicians are really bought into the value proposition of why it's useful, and leaders within healthcare organizations sort of see the AI scribe pilot as a type of proof of concept, knowing that the physicians are championing ahead with this technology. They also are a group of influential people. So as part of leadership, they're sort of championing of the tool gives credibility to the technology itself and sort of strengthens the pilot, moves it forward. And I wanted to, so this is a good example of why AI scribes have captured adoption so quickly and across the health system. The other thing too, there's a lot of risk mitigation because the tools themselves are sort of vetted by authorities. And I just share this screenshot of recent news around the Ontario Auditor General's report showing that many of the procured tools that Supply Ontario endorsed were actually showing many mistakes and hallucinations. And so this really underscores the need for human oversight, even though you're using tools that are vetted and procured, and there's a lot of buy-in from champion users like physicians. The second major finding is that AI business value is assumed, but it's not well defined. So what I mean by this is, again, the term of business value, this refers to health system and organizational value. And we see this 44% of no response amongst participants. And this shows a big gap that, they're interested and optimistic leaders about AI's potential value, but they're not really sure how likely that vision would come to life because of AI. And this tension is because leaders are eager to move forward, but the value definition of AI is very poorly defined, so it leads to a lot of ambiguity and in the value as well as how to mobilize resources and investments. Something I wanted to highlight, one participant, an advanced AI leader, recommended using a strategic operational plan to help get over this hump. And what this means would be to first define the goal that AI would support, and then set clear success metrics, evaluate your position, if you will, if you're going to be a leader or a follower of AI adoption. And then based upon that evaluation, you can then sort of figure out how you would allocate your resources if you're buying or building, for example. And then as you're going forward with your AI pilot, making sure that you have good accountability measures as well. So another case that I want to match to that is a locum matching tool. So physicians who want to go on mat leave or want to take a vacation, they need someone to cover for them. And it's been kind of a gap for physicians to find an appropriate match without sort of doing a lot of manual scanning, which is what one of the founders wanted to solve. So the reason why this new technology they developed is a good example of understanding the business value of AI is because they, through personal and professional reasons, really understood the need for this type of tool to fill this gap of wellness. And therefore they could go forward with a very clear idea of what they wanted to achieve and all the different dynamics they'd have to address with their tool. This is kind of a good way of a good example of how if you know what you're looking to, what goal you're trying to reach through AI, you can then drive the pilot in a way to reach that goal. I want to note as well that her team is sort of multifaceted with different specialties, people with specialties rather, and we can get into that a little bit with the team slide. The other finding is that AI risk management is shaping adoption, not fear. And so what we're seeing here is that many of the leaders don't know, more than half don't know how well their organization is managing AI risk. And again, this is signaling a real gap in governance and AI literacy. There's really three core risk domains in this area. One around data and privacy. So we talked about the importance of protecting personal health information. And in order to mitigate this risk, leaders are moving incrementally with their pilots. So it's not an overnight change. They're monitoring the progress very carefully. And also they're mitigating this risk by relying on their privacy, security, and legal teams as strong allies to make sure that their pilot is achieved responsibly. There is kind of this tension as well between data in itself. It's important because it fuels AI, but then the data itself is quite sensitive with patient information. So you need to balance the need to feed the machine, if you will, as well as making sure that it's high quality data and privacy is built in. Bias and reliability is also a key factor. So you might know the term garbage in, garbage out. It's the data quality that directs those impacts, that impacts those outcomes rather. So this is looking at how data can reduce a bias and increase reliability. A lot of participants noted that there's a risk of using AI systems that do not use Canadian data sets, and that could result in biased recommendations or just information that's not very relevant and suited to the needs and realities of the communities being cared for. So AI here is a tool, but accountability and oversight of the data and how it's used remains at the human level. Trust and misuse of AI is another key risk management theme, and this has to do with how AI is used and explained. We're seeing a big gap between how organizations are talking about their AI, explaining it, and how well the patient is understanding it and therefore consenting to it. There wasn't really a sort of a rock solid way that organizations were thinking through that, but they knew it was important. So we see here that leaders are emphasizing transparency and communication as a way to reduce AI risk, but still figuring that out. A case study I wanted to raise around risk is a chat bot. So one of my participants works in a public health entity, and she was piloting a chat bot for the website. So this is, you arrive at the public health website looking for information. You use a chat bot to look for information you're looking for, finding rather, and then the answers were surfaced based upon the web content. So this is a form of AI that is not sort of purely generative. It's the AI, the chatbot rather, is searching within the ring-fenced arena of the approved web content. And this is a way that they could really mitigate risk. So if you're only drawing from approved website content that the team is monitoring, updating, there is very little risk that the chatbot would spew out information from the internet that could be misconstrued as incorrect health promotional advice. So the takeaway here is that depending on your AI pilot, AI risk sort of looks different. So it's important to sort of think about how your risk factors would what they would be rather in your pilot. The other finding is that AI resource orchestration is really important, probably more than the volume itself. And in this finding, we see that it's, again, majority of leaders don't really know how to build or coordinate their resources. Again, there's a big gap between the ability to respond to this question. 44% didn't respond. So without sort of digging into what that might mean, it just shows that there's a gap. And maybe because we're talking about maturity and adoption, it could be a signal of early maturity, early stage maturity, being having thought through that stage yet. But we were looking at resources in terms of tools, not just tools rather, but including people, their training and governance and infrastructure, as well as the change capacity. So in conversation with the participants, we were discussing how these resources depend on the alignment, the orchestration of all of these elements, not just investing in one isolated area, and taking a grassroots approach to how you look at resources is important as well. So it's sort of comprehensive. The other factor too is knowing your position. So I mentioned earlier about being a leader or a follower, and this quote here is something that one of the advanced leaders said to me that I thought was really telling. So you sort of have to audit your where you are as a leader and your AI, where you sit on the AI spectrum, if you will. And then based upon that understanding of your position, you can then invest accordingly. So we know that bandwidth is limited in healthcare organizations. You sort of have to be selective about what you're going to invest in and how you're going to do that. So we see that with limited capacity, and in some cases, leaders are being creative with their resources by, looking to their peers and sharing information or resources, as well as looking within and upskilling their teams. And the importance of infrastructure. So AI not being just an ecosystem or standalone tool, but it does require integration with other systems and teams to achieve data interoperability, and also ensure that this investment can be a sustained effort, not a one-off project. We talked about prioritization as well, in terms of being selective with the projects you choose. But this was a big theme because there's just so many AI opportunities. So leaders have to find a way to prioritize which one that they will pursue. The other finding here is around the leadership functions of training, trust, and explainability. So there are many drivers of AI adoption, as I've tried to illustrate here, and education is by far the top priority, if you will. And this links back to the literacy piece. So again, if you don't understand something, then you can't optimize its use. And education was identified as the top factor driving AI adoption. So there's the foundational need to build that base literacy amongst teams. But training is also an important part, and it needs to be also done at an interdisciplinary level so that everyone in the organization understands how AI is used and how they are expected to interface with AI and how their work would be transformed through AI. One leader even looked at AI as education as both defensive, so mandatory training, versus offensive, where you're creating new opportunities for innovation. And then also with respect to explainability, this has to do with how you're communicating your AI sort of value as well as use for patients and even end users. And understanding this and explaining it well is a critical factor to building trust in AI itself, as well as trust in the organization that's using the AI so that they understand that you're using it in a way that's responsible and will improve outcomes. There were a few leaders that talked about the importance of using plain language and storytelling as a way to sort of demystify AI. So those are some communication recommendations that could be really important, especially though because AI is somewhat mysterious to many people. And also leaders need to recognize and address that there's change inhibitors and enablers. So as you're bringing the organization through this transformation, being aware of how change is touching your teams and how their change sort of capacity is and supporting them becomes really important. So brought all together, all these factors will help build trust over time, and that is important as you're bringing the organization through a significant transformation, bring them on site. All right, so I'm going to focus now on the recommendations component. I wanted to present the AI adoption roadmap here, which is a four-phased model that is meant to be a practical guide for leaders and brings together the different components that I've just talked about. The goal here is to provide a practical path from experimentation to impact. And the first stage focuses on having that clarity of why you're using AI and what's the problem you're trying to solve, as well as building that core foundational of literacy. The second phase would enable organizations to make AI safe and scalable using frameworks, governance, and infrastructure. And this is built the building blocks of developing trust to enable that adoption. The third phase would be the implementation of the pilot through safe safeguards as well as feedback loops and keeping human in the loop at all times. And the fourth phase is the actual integration. You're scaling what works and you're going back to your metrics of success, reviewing and evaluating based upon those goals. And those insights would also feed into your next cycle as well. So it's meant to be a cyclical process here, knowing that AI adoption is a continuous cycle, not a singular finish line. I just want to be mindful of time. Should I pause here or should I keep going?
You have another minute or two, I think, Karen.
Okay. Okay. I just maybe for another second here, I had some questions around, in the spirit of being practical, some questions that leaders can think about when they're going through these phases. And hopefully the answers to these questions would allow them to come to an understanding of where they need to be at each phase in order to move forward and to design AI responsibly. My other slide here is around the actions that we can expect to be taken at each stage as a result of going through those questions. And again, the intention is this to be quite practical. So these are also maybe some ideas to think about with the team when you're going through this exercise. The limits of my research here is that one main one, just in interest of time, I sought out to understand responsible AI in terms of its values of trust and transparency. But the principles themselves around responsible AI were actually lacking in a lot of the participants. So I thought that might be an interesting additional study down the road to dig in a little bit more to what responsible AI actually means for leaders and how in healthcare that's actually shaping the direction of AI adoption. So just to conclude, I sought to fill a gap initially with the study of intention and experimentation with AI to a way of using AI that's sustained and clearly driving impact and done in a responsible way. So I hope this study has helped to fill those gaps by understanding the different stages required to think through what would be important for the organization as a whole through the framework. And a thank you. I'll just do a little shout out here. So thank you to my cohort. I think a few of you are here. It's been a blast. And obviously, I think my husband's on the line here. Thank you, Nolan, for everything and giving me capacity to do this as well. Okay, I think I'm at time, so I'll just stop there.
Perfect. Thank you, Valerie. So let's move into questions. Mr. Stewart, you get first question.
All right. So congrats, Valerie, for making it to this point in the journey. I was chatting with Alex earlier, just coming back from CPRS, and we were discussing how obviously the topic of AI is omnipresent now, and everyone's engaging or aware of or touching in different ways. But what's really starting to become relevant and practical is the very contextual use cases. So I think that your focus is very timely and relevant because on the vector of risk and opportunity, which are amplified by AI, you're focusing on a sector which has very big concerns about risk, right? We're operating in healthcare with people's health. On the flip side, when it comes to opportunity, there's obviously many opportunities, but also our healthcare systems are under tremendous strain. So any advantages, improvements, efficiencies that can be found obviously can be incredibly impactful. So I think all that to say, it's a very relevant area that I think you picked to focus on. Today, people got an overview of the scope you covered. Your paper was very extensive. You covered a lot of ground, and you looked at the many factors that go into thinking about why, how, and in what future way should we evolve our use of AI. So that being said, a few questions to get us rolling. One was based on your kind of hypothesis or what you thought or your understanding of this domain and its scope, and just the risks and opportunities for Canadian healthcare. What big learnings, ahas, surprises, kind of awakenings did you have as you took this broad topic of AI that we're all familiar with, but then got really deep into a particular domain?
Yes, I think the risk, sort of what's at stake, was really striking to me, because healthcare deals with life or death it's at different degrees. And the news that you guys may have caught on about the Auditor General's report is actually quite striking, because although those AI scribe tools were all endorsed and vetted, the systems themselves still showed a lot of error. So it creates amplified risks in the healthcare sector. And I think leaders need to be really aware of their risk profile. I think that when I talk to leaders, I hear their ambition, I hear their desire to innovate, and they're sort of looking around them, and whether it's their board or their peers, they feel a degree of pressure to kind of get on this AI bandwagon. But doing so without really understanding your risks is risky. Um, and the need to not only have literacy, but then to have the skills to analyze and have oversight is also really key. Just riding on the train of that article, there was an op-ed written by one of the section leaders of the OMA in response to that, and he was basically saying a very similar conclusion. It's the humans that are making the decision. It's the doctors that are accountable at the end of the day. So all the more reason to understand what you're dealing with and use it in a responsible fashion.
Excellent. And yeah, I just wanted to comment as well. I like that you incorporated a model, and it's actually a model that's very common to strategy. I mean, you referred to it as strategic AI, but this concept of doing your research, evaluation, considering use cases, putting it together, iterating, etc., keeping that loop going, I thought was very useful, because at this point in time, a lot of organizations are doing things very differently. And so it's useful for them to have a comparative case study that you've given, and also a tool or framework to kind of navigate through as they evolve through their own journeys. It was interesting in how many of your questions, when you're doing your research, organizations just said, "I'm not sure." So like the level of maturity that I inferred from reading your paper and from your presentation was that it's relatively low. And I think part of that is our systems are so strained that how do you carve out a project or a set of projects to thoughtfully think about AI while you're like just trying to keep your emergency room open?
Yes.
So kind of connecting this to strategy, if you were to walk into an organization as an advisor saying like, we do think this is a big deal, but there's 500 other things that's a big deal. What would your strategic advice be on how to carve out capacity to actually do these projects?
Yeah, she does.
Oh,
Yeah. It's a
someone might
great
be on the mic there. How would you advise an organization to actually find a Canadian healthcare organization to find a way to carve out the capacity and attention to actually use your model?
Yes, it's a great question, and a reality that's all too familiar. I think or we can actually learn from the organizations that are on the low resource side, and their creativity and partnership with associations to pool resources together, um, and learn together from a resource sense of capacity. And then some organizations have actually offered training. So one advanced leader is leading a national AI training academy, he calls it, and it's open to healthcare leaders. So I think if education is being offered in sort of this formal way, all leaders need to go through professional development. Actually, all teams in general should go through professional development. Maybe if there is an understanding that AI should be part of your professional development plan, then that capacity could be built into your ongoing learning, because we understand there's an understanding of an expectation of ongoing learning that's part of your job. The other idea is learning from your peers. So this is part of that sort of association approach. But just talking to other peers that are similar to you or going through similar struggles could be a way where you can kind of work through the challenges. Because I think as leaders start to learn about AI, it just creates more questions in their minds and sort of more areas they realize they have to address, which might feel overwhelming. But if you can talk to a peer that's maybe in a similar area or size or service focus as you, then you can kind of work together on it.
Yeah, I appreciate that. I think that word's appropriate, overwhelming. So I appreciate the contextual feedback and guidance on how to create some capacity. Steve, I'll turn it back for this round over to you.
All right, thanks, Mark. Let's go to Alex for the next question.
Great, thank you. So I'd like to echo Mark's comments. It was a pleasure to read your thesis and to work with you along the way. I know we gave you lots of feedback, and you handled it all with grace and cheerfulness. So that was very very nice to work with you. And you've really made a contribution here, right? So I think that's something to be applauded. That being said, I had a couple of questions. I'll start with you and I have had many conversations about AI and PR and more recently health, communications and health and the medical field. So is there anything in your findings that challenged your original assumptions about AI adoption in healthcare?
I think the gap between what the best recommendations are in, say, the literature review and where leaders are today. I mean, mind you, my sample is very limited to Ontario-focused, publicly funded organizations, so I didn't have a lot of representation with private healthcare organizations, let's say. But within that subsector, if you will, there's just such a gap. So that the desire to move forward with ethical intent and to also use AI in a way that drives actual outcomes. You can attach the outcome statement to your strategic plan. It doesn't have to be a new one. Actually, many leaders recommended picking something that already exists and attaching AI to an existing mandate. But there's such a gap. I didn't realize how big, really. So I think the road is long, but that part to me was surprising. Yeah, I really would have liked to have done a study across the private sectors as well, and public to kind of understand, where the similarities and differences are. But some of the literature specifically that looked at advanced AI adoption in health, they look different than Canadian organizations. They were well funded. They are in a different country with different regulations, and they have capacity for this. There's not a lot of capacity amongst the participants I spoke with.
Yeah, it's definitely a theme that came out. And I if I were you, I think what you've done is great. I mean, because you've done a deep dive into public sector health, so I think that's very valuable. And we didn't want to turn it into a PhD thesis. Or you can always do that in the future, right? As part of your practice or consulting practice. My second question, that is to say the private comparison. My second question is about is a methods question, and I know how you did it, but maybe you could clarify for the audience how you did your qualitative analysis. So how did you move from raw participant responses to themes, from themes to final strategic roadmap?
Sure.
What's the logic there?
Sure. So I had with the survey, I gathered all the responses and grouped them. Well, there's some quantitative data in the survey itself, so I was looking for that purposefully. So there's a blend of qualitative and quantitative data to enrich the findings. I used the survey, let's call them figures, as a little bit of a jumping off point to start to think about it. So I had done my literature review. I had these concepts and themes I wanted to maybe test or think about. And then when I had these sort of key stats, if you will, then that helped me sort of think about what are the dynamics underneath these numbers. So then when I analyzed the transcripts, maybe that's what you're looking for. I had transcripts recorded for every interview and focus group. And then I used a thematic analysis guide by the CDC in the States, a very step-by-step guide to codify your transcripts by codes, hand coding, I should say. And so you're going through and you're analyzing line by line the transcript, how that might be associated with different codes. And then you start to group the codes together into bigger bucket themes. And those themes started to give shape to the broader findings I wanted to explore and also test back with what I was seeing in the literature. So it is quite a systematic approach. It was hand coded, though, I should say, but using this thematic analysis tool, just high level.
And how did you get from there to the roadmap?
Okay, the roadmap. So I thought through so I did conduct the findings and kind of thought about it, and then I thought about what is the takeaway, and because I really wanted the capstone to have some utility and practicality, I thought, what do leaders do with this information? If they are on that journey, right, experimentation, and they want to get to a state of sustained impact, what can they do? And what are the advanced leaders saying from the study? So I thought about it. I analyzed I thought through the main findings, and those themes became signals to me about areas that should probably be addressed. So the resources, the literacy gap, amongst all the factors to adoption, what were the key themes? And I can actually count them because of the quantification of my codes. And if it had a higher count, then that signaled to me as something to pay attention to feed into that actual roadmap. But also, I'd say it was also the advice of some advanced health leaders around how they went about answering this question themselves. So some leaders I spoke with are quite advanced, and they have gone through this journey with success, and are able to talk about it and pass that on and teach others. So I drew inspiration from their guide, as well as filling in, important context based upon the findings from the triangulated study as a whole.
Okay, great. Yeah, thanks. I appreciate that. It's well stated. My last question is about the lit review, which you put so much effort into, and it's really quite a thing of beauty, actually. So I want you to tell me which body of literature was most relevant in the end. So you've gone through all this analysis, you've done this coding, you've done the quantitative work, and you've designed the roadmap. Looking back, using this sort of critical thinking, what's the most relevant piece of literature or area of literature?
Sure. I think it's the literature that combines or tests a theory in a clinical setting. So I read lots of theories about AI adoption, change management, and there were many frameworks that I encountered. But when I think about the research relating real life application to test a question, that was most striking to me, and because you're testing these theories in a health setting. So very similar to maybe the earlier part of the discussion, how there's such a gap between the theoretical ideal and what's actually happening amongst leaders themselves today. When you can start to bring them together and then start to see how leaders actually made a change or where the opportunities were, that to me was sort of the most helpful because it provides, I guess, guidance from. Sorry, it provides actual sort of action from guidance. And if it wasn't quite the same as what they thought, then those gaps became important to uncover and address in other ways.
Great. Thanks. I appreciate it.
That's it, Alex?
Yep.
Okay, I'm going to ask one question before we go back to Mark quickly. And you touched on this. You talk to people who are in the public practice, which means they're funded by the government, which means that there's this potential for the government to need a social license from the population to move ahead with advancing AI. And when, there was a CMA study that came out in February that said only about a quarter of Canadians trust AI when it comes to healthcare practice. So with a low level of trust amongst the Canadians, what the government may not be as interested in or feel they have that social license to push to have regulations, to allow for training, to allow this to go forward. Did this come up as a stumbling block in any of the conversations you were having with the healthcare professionals?
Sure. So you're asking about whether there was a lack of social license to use AI?
Yeah.
Um, In a way, no, because there was AI use happening in the background. So it's a paradox, I think. While there is a hesitation or a hesitation to trust, let's just generalize it in the public around using AI and its reliability, perhaps. Um, there's a similar study that shows I had to look at the reference, but that AI consumer use is very high.
Well,
Uh,
it's actually the same study.
okay.
More than 50% of Canadians use it for their own healthcare, but don't trust it.
Right. And
Yeah.
I think just yesterday, I had it open here. Just yesterday, there was an article around AI use for sort of self-diagnosis, which is a terrible thing to do. But when you ask Dr. Google, or in this case, Health Chat GPT, which is coming to Canada eventually,
Yeah.
a lot of Canadians felt that they could not trust the recommendation from AI if it's done sort of on your own. So let's call it sort of through consumer AI. And I think if you contrast that with um, a similar trust study, I think maybe CMA as well. I'll have to double check. It's there's a trust in no, this is Edelman actually. They did a health study recently. There's a significant trust that remains in the providers themselves because they're the experts.
Yeah.
So I think there's a difference between me as a patient using AI and I'm not clinically trained, and AI is telling me to do these things based upon the symptoms I've listed in, versus my doctor who is trained and using AI as an assistive tool. There's actually more permission there from patients. So to your question on social license, because the tool is being used in the hands of a qualified professional. So there's also an assumption that they're using it properly,
Yeah,
but I think
exactly.
that's the desire.
Okay. Thank you, Valerie. Mark?
Yeah, so last question, for those listening or reading who are not directly working in Canadian healthcare, how would you describe your interpretation of the transferability or applicability of your findings and even kind of your final model to different contexts?
The ability to apply it across different contexts.
Yeah, basically like, you came up with a really interesting model instead of recommendations. You ultimately extracted that from this kind of deep dive into a specific domain. But, would you see or recommend other people be able to use a similar approach as the, recommended model you gave at the end, pretty much anywhere they're considering AI?
Yeah, I think it might be applicable more in settings other than health. Not being an expert in many other sectors, I've mostly worked in health in my career, but I think the guidance is conceptually high level, but relevant enough. So I'm just looking at it here on the screen. So the first phase being to orient where you are in your AI adoption journey. I think that's a good question to ask of anybody who's taking adoption seriously, and thinking about why you're using it. And then the second phase of enabling that in a responsible manner. So you have to go through the exercise of understanding what the tenets of responsible AI is in an infrastructure perspective, ecosystem perspective, and then start to think about how you're going to invest in the tools that you're lacking, maybe, or resources. And then the third stage of actually going through the pilot that you've identified in phase one with feedback mechanisms and humans in the loop. I think that's applicable as well in other domains. And then the fourth part about making sure that what you've learned is refining what you've learned in that cycle is refining future pilots, and you're adjusting as you go. So I think there's a lot of uh, applicability to beyond health, perhaps.
Yeah, appreciate the interpretation. And the reason I'm kind of bringing it up for your benefit is really what you've created is a strategic framework particular to AI, which is obviously a very eminent topic at the moment. And, as a consultant, and for yourself as somebody who does related work, taking that same approach of taking a methodology, bringing it to market, running clients or your own experiments through that methodology and seeing what outcomes you get allows you to continue refining your methodology and really putting a stamp on it as something that you can potentially own or really encourage markets to use. But I do think it's a thoughtful one. So I think it's a nice artifact of what you've put together. So well done. Dave, that's all for me.
That's it. All right. Thank you, Mark. Alex, one last chance to ask a question.
Mark kind of asked it. I was going to ask, what are you going to do with this research next? And Mark has kind of alluded to it with the.
I alluded, but maybe there's more.
Anyone from the gallery would like to ask a question? Oh, Christina has a question.
I couldn't let you down, Alex, and not have a question. So, Valerie, that was fascinating. I've learned so much about healthcare from yourself and others through this program. And it was partially discussed a little bit. So you focused on Ontario, and what I heard was one of the key things is around funding, right? Like they just don't have capacity to take it on. Do you think that variable might change in other locations where the social context of healthcare is different, or the willingness to take risk is different, aside from funding? Are there other factors there that would influence adoption other than funding in healthcare in particular?
Yes, I think is sort of the short answer, and it's funding is just one element of resources. You're also thinking about your teams and their time, and even to Mark's point earlier, just keeping your ED open, so operationally. There is one advanced leader from Quebec that I spoke with, and I would call them very sophisticated in terms of their ability to adopt, not because they had more money, but because their leader was very mature in their understanding, not just of AI, but technology. So this organization in particular has innovation mandate built into what they do. And that is different, I found, than what I was seeing in a lot of organization-based, Ontario-based organizations, where it's really focused on driving quality care based upon sort of the traditional methods. But technology wasn't a core part of that service delivery. So all that to say is the difference with that leader is that there was leadership buy-in and a deep mandate of being innovative, and that so the people on that team, even the type of titles they had software engineer and data engineer, and they could name off 9 different roles, and they were all there. And I can tell you that a lot of leaders I spoke with in Ontario may not be able to even name the type of team composition they'd need. So maybe it's a question of understanding how technology can be a partner in enabling better care.
Mm-hmm. Sounds almost cultural a little bit, or values-based. Yeah, fascinating. Thank you.
All right. Thank you, Christina. Anyone else? Actually, we should move to the next session. So we're going to move everyone into a private room, and Alex and Mark and I will have this discussion, and then we'll bring you back. So make sure you come back afterwards, and make sure you go to the room now so we can have that discussion. And Valerie, we'll see you in a few minutes.